Now, Dr. Heal, the floor is yours for 5 minutes. Thanks.
Thank you very much for inviting me here today. I have been a nurse practitioner for close to 27 years, and I'm a full professor at Laurentian University. I continue to practice as a nurse practitioner and opened the virtual menopause clinic 4 years ago. And I've learned that women in midlife undergo profound physiologic changes that result in a whole host of symptoms. Every woman is different, and the symptoms they experience and the severity of them can vary considerably, but perimenopause and menopause symptoms impact all areas of a woman's life, most definitely work. Many of my patients have told me the impacts of these symptoms, and comments like, "If you hadn't treated me, I would have had to quit work," prompted me to develop a pan-Canadian survey to gather data about this experience. The survey is still live, but the preliminary findings are concerning. 47% of the survey participants reported that they've missed work because of symptoms. 45% have reduced work hours. 43% have taken sick time or vacation time to manage their menopause symptoms, and 31% are considering leaving their work. Overall, the findings are not surprising. Menopause symptoms significantly impact work, and in addition, most workplaces lack policy, awareness, or accommodations. The findings mimic what we know. Up to 10% of women leave the workforce because of menopause symptoms, and these are their peak earning years. So these are going to have an impact on them financially for the rest of their lives. The cost to women is enormous. The cost to organizations, employers is huge, with an estimated $237 million annually lost to menopause care and symptoms, and an estimated cost to organizations of up to $50,000 to replace senior employees. We can't talk about menopause at work without talking about the barriers to receiving care in menopause. The lack of accessibility to knowledgeable menopause care providers is very common. Accessibility to affordable treatment is a barrier, and more women are turning to private pay. Hopefully, when all provinces have direct remuneration for NPs, this will solve part of the problem. If a woman doesn't have drug benefits or coverage for things like counseling, they have to pay out of pocket, and that menopause treatment is prohibitive. It's very expensive. There are other related issues. The ongoing black box warnings on vaginal estrogen products have been removed by the FDA in the US, but remain in Canada. This contributes to the confusion and the tsunami of information and misinformation that women experience about menopause care, as well as the hesitancy of some providers to providing with actual care. There are many strategies that could be considered at the federal level. And first, to continue to prioritize menopause hormone therapy in the National Pharmacare Plan, and to trigger reviews of products so that the approvals are aligned with evidence. Next, to continue to ensure that all jurisdictions develop direct remuneration for NPs to help reduce costs to women, but also to consider the establishment of regional centers of excellence. And I know there are a few across the country right now, to train healthcare providers and create public education programs, the goal being to move menopause care back into primary healthcare. Another is to consider menopause as an issue of equity. Again, the UK has legislation to eliminate discrimination against women when they need to adjust their work related to symptoms. To advocate for workplace environment standards, such as policy frameworks, which emphasize things like physical workspace adjustments, ventilation, or even just access to appropriate washroom facilities. Review a national health workplace strategy, such as in England and Scotland, which supports menopausal transition in the workplace, strategies such as employers signing pledges to implement formal menopause policies. And finally, to consider funding and developing a national clinical guideline for the management of women in the menopause transition that truly reflects current evidence and practice. Menopause at work impacts millions of women. Providing care to women in the menopause transition has shown me how much needs to be done to ensure optimal workplace environments during this critical stage. And I look forward to this report from this committee. Thank you.
Thank you so much.